a shift in reality. Older people are being left by themselves right now. It's getting more evident that professional caregivers are a requirement for us in Nigeria.
Hi, everyone. Welcome to another episode on our Care Conversations at My Cura. My name is Abiola Hakim Matailara, and with me today is one of my very, very dear friends from over 10 years ago. She's a qualified nurse and she works with the NHS in the UK and also a quality safety expert. Blessing, thank you for joining me. Could you please introduce yourself to everyone?
Hi, Biela. Thank you so much for having me. Okay, so my name is Blessing. I have been a nurse for over a decade now, and I've had the privilege of practicing both in Nigeria and also within the UK care system. And I'm also quite passionate about patient safety and making sure that patients do not come to harm when they're in hospital or in contact with any healthcare service. Because of that, I'm pursuing a master's in patient safety as well. And yeah, that's me in a brief sentence.
Thank you, Blessing. We've been on this journey together, with starting my care assistant, now my Cura, and you having to transition from working in Nigeria back, and then going back to the UK, and then mommying, parenting, working, schooling, juggling all of this together, and still having the heart of people, at your core. So today I want us to, have, that conversation around quality care. Why do we say quality care? I know it's a measure, but how can individuals, especially people that are vulnerable, how do they even, what is even quality to them? For some people, it could just be that having a daily meal is something that they feel is quality enough, or even having quality sleep, just having a good night's sleep is quality to them. But in the broad spectrum of things, how should we begin to think about quality care as it concerns vulnerable people in our society?
I think to me, quality care to anyone, even adults, kids, elderly, is beyond treating their diseases or looking after their illnesses, but also, connecting with that person, meeting their needs as they are describing it, not just seeing the patient in the hospital and all you can see is their symptoms and them just writing them a prescription to say, go and sort this. You're asking them, do you think you'll be able to take these tablets? How long do you think you'll be able to take it for? Do you think you have enough support at home, to go through with the treatment plan? You're going beyond, the prescription, the medication, the wound dressing, and also considering their social issues, their cultural issues, sometimes religious issues as well. You're looking at the human holistically, not just looking at the person in front of you, but also looking at the support they have at home, if they would even be able to continue with the care you're giving them, because there's no point treating them in the hospital if when they get home, everything gets scrapped. Do you understand? So I think to me, quality care is delivering care to the individual as a whole and not just, treating the disease or the symptom that the person has presented with.
Thank you. I think you've just, pin it down to just going beyond checklists and protocols, having that holistic, congruent, mindset behind the care that we render to patients. So from your experience, I know you've managed diverse group of patients before. From your experience, what are the challenges that vulnerable people, especially the elderly or even kids with learning disability have as regards to, being cared for in the most adequate way? What do you think are the challenges they have, and how have you, as a person, or as a healthcare professional, been able to support this vulnerable group of people?
Thank you. I think one major challenge that vulnerable groups of people have in our society today is the fact that when they come into healthcare, when they come in contact with any healthcare professional, we've all been trained to look after a certain type of adult or a certain type of child, and not look beyond the fact that human beings actually come in different, forms and shapes and needs, when they present in healthcare. So one challenge they have is the fact that there is I wouldn't say specific protocol, or there's a specific, expectation that we expect things to conform to. And anyone that deviates from that norm begins to have some challenges. I would say, for example, a patient with learning disability comes to the hospital, and we're trying to get the patient to take medication, and this patient does not like to drink water, does and back when he's home, he drinks tea and he has squash, and he's fine, he survived on that. But because the person is in hospital, we are trying to enforce and say this person has to take their medication with water. Why do they have to take their medication with water? Because we are used to that. That's what we know. But looking beyond, what we know and adapting to that vulnerable person at that time, especially vulnerable people that cannot even advocate for themselves, that are in positions where they're not verbal enough to tell us what they want. It's looking beyond I wouldn't say prescription, looking beyond what we do on a day to day to see how things can be done differently. How can we approach things differently to get the same kind of results that we need? I think this is even a lot better over here, abroad. I remember that when I was in clinical practice, I remember that a lot of times there are certain individuals that have been trained to deal with patients with learning disability or to cover, elderly care. I'm not sure about how it is back home in Nigeria at the moment, but I remember during my training, there wasn't anything about learning disability. And it didn't mean these people don't exist. They are in our society. We probably see them on a day to day, but we have to find a way to adapt our learning and our training to meet those people that we feel they don't fit into that box of who an individual should be or what an individual should need at each time. I hope you understand what I mean. Like, we have to find a way to train people to think that everyone is different, and dealing with each person as an individual. I think it still goes back to dealing with every individual on an individual basis.
Thank you, Blessed. I think you actually hit on a point there when you talk about training people specifically. So, what we do at MyCura, one of that is training people, training care professionals, helping them to be more skillful in managing patients. What would you say regarding training of, care professionals, not necessarily care professionals, so to speak, maybe training people that are just graduates from high school or from university, people that just have a passion for care. They want to provide this support. They just want to do it, but that whether know-how is not there. And do you think it should be a compulsory thing? Should it be a quality measure that before you can provide care support to anybody, you should have at least an iota of training, maybe just a foundation in care to support any individual that is vulnerable?
With healthcare, things can easily go AWR, and especially if you don't know what you're doing. And for everybody that would be in contact with a vulnerable person, I think you need a level of training or a level of knowledge, education, that meets a certain standard before you can, be like the responsible caregiver to that person. I'm not saying in terms of care that family give, I'm saying in terms of professional care that can enhance the life of an individual. I think, yes, every caregiver should have a level of training or a level of knowledge. It's because caring for somebody is beyond what you can just go on the internet to read about and just carry out. If it was very easy for us to just go online and read, doctors do not have to spend 7 years, training. Nurses do not have to spend 5 years learning what they're learning. But because care is very, how would I say this? It's very intricate. It's really delicate sometimes. You need that knowledge. The knowledge base cannot be ignored. And it's not just knowledge, you need the right knowledge and the right skill to actually look after people.
Thank you. So I have one very interesting question here. If you had to redesign the care system from the scratch, what would you prioritize first?
If I'm to design a healthcare system, if I got you correctly, that's what you said, right? If I'm to redesign a healthcare system, oh, a lot of primary care will be emerging for me. I think we focus too much on secondary and tertiary care, and primary care is actually the heart of healthcare. Without primary care, we're literally just building with no foundation, and there's no way it would not crumble. Primary care, and what I mean by primary care is that preventive, that beginning, that foundation of healthcare where you're teaching people on a community level, you're supporting people in their houses, things like immunization, vaccinations. I know we have a lot of primary healthcare centers in Nigeria, so it's not like we haven't thought about this. We know what to do. It's just that we haven't prioritized them enough. So if I was to redesign healthcare, I would prioritize primary care. I would make sure that community led care, community led nursing, community led medicine is actually, you know, given much more attention, especially now, especially in this age and time where we have people have so much information on their phones, and it feels like everybody knows the symptom that they know the disease condition they are dealing with before they even get to the doctor. Primary care is a good place to be educated about your health. Somebody with hypertension, people with diabetes, chronic illnesses, they don't need to go to a tertiary institution to see a consultant. What they need is actually primary care, where their doctor knows them on a personal level, their doctor knows their wives, their doctor knows their children, and they can, give them tailored care, care that is tailored to their specific needs. There's so much pressure on tertiary healthcare systems, and I think that's why we're where we are right now, where we're not yet there, isn't it? And if primary care can be sorted, a lot of pressure will be relieved from the secondary and tertiary institutions, and it means people would have better healthcare generally.
Yeah, and I think you're very, very brilliant with that. Thank you very much, Blessing. So I mean, to kind of wrap this up, in a way, tell me, we all know that in Nigeria today, we are very culture driven. Family members, which you actually mentioned, family members would care for their loved ones, than getting care support. In fact, case in point, I went to visit one of my new clients yesterday or so, and she doesn't want the care support at home. She's a 75-year-old woman, very independent, very strong, and she just feels like it's going to be a burden. And then I was trying to talk to her that, Mama, you would need this support. And she said, you know what? I don't need it. I have my life figured out. So I said, what about a day or two in a week? She said, once in 2 weeks. But I mean, why am I saying this? This is a 75-year-old woman who actually is still very prime, very energetic, still very much in tune with herself and her body and her environment. And she's saying that she doesn't want somebody to come and live with her, but she actually appreciates the fact that she can get care support, even if it's just once a week or twice a week. So tell me, is this obtainable abroad? How can we better, do this in our own cultural setting to help our elderly ones, even our young moms, to appreciate the fact that they need care support. It doesn't have to be something that is going to be burdensome, but something that is going to be very useful and for them to feel heard, seen, and valued.
Yeah. Care support now. For years before, you know how we're such a family based or family oriented kind of community, isn't it? Where most times somebody is at home, so the elderly or the sick or the vulnerable are not completely left to be by themselves or on their own. So they feel, I don't need a stranger to come into my house and, take over everything that is happening, isn't it? But nowadays we see that everyone is, kind of out there trying to be more productive, trying to, it's not, we're not like back in those days where there's one child that you have left behind that is going to be looking after you for the rest of your life. That child is going to grow up, go to school, get a job and move out of the house at some point. So I think it's beginning to become a shift in perspective, and there's a shift in reality. Older people are being left by themselves right now. So it might not be very evident at the moment, but I'm sure in the
Yeah.
next, 2, 3, 5 years, it'll be very obvious that people need to start considering hiring professional quality caregivers, because that child that you're looking at, or that family member that you're looking at, has also their own jobs to do. Sometimes you think, oh, this person works from home and they'll be able to peep in and see me. But what if in the middle of their meeting you have a fall and
Right.
they're not able to get to you at that time? A professional will be by your side, probably prevent you from having a fall, but a family
Right.
member might be away and doing something else. Even if you say, oh, I have a house help that can help me, your house help's job is not to look after you, isn't it? They're to help you, get your
Right.
chores done and help you maybe prepare your meals and things like that. So having regular support, which is the way things are here, but I don't want to do like a comparison because the social system here is quite different. In this sense, I think they have the other extreme where
Right.
their family members don't even bother anymore after they've hired somebody. I think that's the other extreme of the social care service. But it's getting more evident that professional caregivers are a requirement for us in Nigeria. Your family can only, do so much. I know someone, especially now that, a lot of young adults are moving out of Nigeria even. That we're not even talking about people that are not living in your house anymore. They've moved to another house. There are people moving out. There are families where, all children, there are 3 or 4, they're out of the country and their parents are left by themselves. And maybe one of the
Yeah.
parents dies and the other person is left, on their own. So we need to start thinking about these people and our older generation. How can we support them, give them quality support? I remember a friend of mine whose mom had a surgery, and it was a struggle trying to find support for her at that point. They were trying to get a house help, and I was trying to pose a situation where, why can't you hire a professional, like a
Right.
caregiver to support you through this, post-op period. But I don't think, they saw the reason yet at that time. After a while, I think they did, but then after a while, it became obvious that a house help would not be able to do this, would not know how to manage this. And every time your phone will ring and your phone, they'll be calling you to say you did this and you did that. So yeah, it's very, very important at this point to start considering higher, enhancing our social care system, giving support to professionals, to train caregivers to come into the social care system. It's so important.
Yeah, thank you very much. And do you think there's a way we can measure this qualitatively so that there is evidence to show? I know in developed countries, I mean, that is like it's a no-brainer. We measure these things so that the government can see the need and then provide resources such as funding for it. But in Nigeria, where you have to you're majorly self-funded, but then how do we begin to actively create measures to show that evidently this support is needed? You mentioned something very, very pivotal when you said that in the next 2, 3, 4, 5 years it's going to become very much apparent. Unlike what we're seeing now, people still think they can do it all by themselves until they begin to realize the need at a very high level. So what are those measures, those quality measures that we need to take now, those evidence we need to get now to make sure that people begin to see the need for care support, for quality care, and to also help them to live a good quality life?
So I think that is a very, tricky but very essential question. Because over here, I don't have to think too much. If somebody has a fall, I know that when they get to the hospital is taking note of it, and they're measuring how much, how many falls has this person had in the last how many months. That is a no-brainer. Nobody needs to tell anybody. It's just there's a system in place. So I think even as individualized as our healthcare system is in Nigeria, and when I say individualized, I mean every hospital is working on their own. There is no connectivity. I think even as that silo is happening, we need to start putting in measures in place. If a hospital setting or if a clinic has a way that they're documenting and taking notes of, say, we discharged the patient last week and they're back today. If they had a caregiver at home, they would have known that they don't need to do this, they need to do that. Do you understand what I'm saying? If there's a way they're taking notes, how many unplanned readmissions are we having? If it's due to something that the social support can solve, how are we taking a mental note or taking down data? Because data is very important. If we're not taking data, we won't know what to plan for or what to build for. I think, and it's so good what you're doing as my care assistant as well, or my curer, because it means that when you meet a patient and they're telling you their history, you've been to this patient and say, oh, they came out of hospital last week, they had the surgery and they had a fall. You have one patient that has had a fall, you're taking notes. Next week, you can easily tell if you go to another person's house and they have the same symptom or they have the same complaints, you will be able to say, oh, we can put one and two together and see that this is becoming a pattern. If you have it from the same hospital, you can go back and say, we've noticed this, that two of our patients have had this done in the past, and they've had complications and they've had to come back. Why don't you consider this for your next patient? Just tell them that we're available to support them so that they don't have to come back for this. You understand? So it has to be. Unfortunately, we don't have a government that we can advise on policy to say this should be policy in healthcare. It has to now be you as an individual, you as an entrepreneur, the doctor that owns a clinic, the pharmacist that is running a chemist, people being responsible and taking data. One day, I'm sure, one day in the future, Nigeria as a whole, we will collect data in our healthcare service and we'll be able to say this is what the trend is, or this is what we've observed, and this is how we can mitigate anything like any harm from happening to these kind of patients. But until then, we have to be responsible as providers to be the ones to take this data.
Yes, thank you so much, Blessed. It's been a very insightful session with you. Should we continue? I'm missing you already. Thank you for joining on the call. I appreciate you. So till we come your way next time, this is my Kira Care Conversations. And yes, follow us on all of our social media platforms at my Kira Care on Instagram, Facebook, Twitter.